This week, Singh Health Singapore invited Fatma Jannah Medical University research delegate to participate in the regional Global Surgical Network Symposium held to share the results of international collaborative research on COVID impact on surgery and actions taken during COVID-19 pandemic. Members of the delegate included former Vice Chancellor of Fatma Jannah Medical University, Professor Amir Zaman Khan, the present Vice Chancellor of Fatma Jinnah Medical University, Professor Khalid Masood Gondal, the Dean of the Faculty of Surgery of Fatma Jinnah Medical University, Professor Kamran Khalid, and Dr. Shabir Chauhan, the focal person for Work Stream 3 of colorectal cancer surgery. Fatma Jinnah Medical University was the only institute representing Pakistan as collaborating partner with Singh Health Singapore initiative on international research project collaborating with 8 different regional countries. Around 50 renowned research scholars from 8 collaborating countries shared and discussed their research data and results in 4 work streams, including bellwether surgeries in work stream 1, breast cancer surgery in work stream 2, colorectal cancer surgery in work stream 3, and hospital and resource management in work stream 4. Fatma Jinnah Medical University participated in all the 4 work streams. The symposium started with welcome address by Ms. Vijaya Rao, who is the Senior Director and International Collaborating Officer, Singh Health Singapore. This was followed by the opening address by Professor Tam Hyong Hoon, the chairperson of COVID Impact Study. Later, Professor Kenneth Kwok, the CEO, Singapore General Hospital, delivered the keynote address. Fatma Jinnah Medical University delegate shared the data on bellwether surgeries, including emergency laparotomies, cesarean section, and open fractures, and actively participated as panelists in the panel discussions on bellwether surgeries, breast cancer surgery, colorectal cancer surgery, and system level comparison of hospital and resource management. Professor Amir Zaman Khan, Professor Kamran Khalid, Dr. Shabir Chauhan, and Professor Khalid Masood Gondal threw light upon national and local impact of COVID-19. The Vice Chancellor of Fatma Jinnah Medical University, Professor Khalid Masood Gondal, discussed the training issues faced by the undergraduate and postgraduate trainees during the COVID period and how were these overcome by the institute. In his panel discussion, he said,
We know this is the now era of medical education. I myself have a PhD in medical education. Initially, we had the apprenticeship model of training, teacher and student. Then we had the product and process based. Now all over the world is the competency based medical education, outcome based. We started from Canada, ACDME competency, and Pakistan has competency based medical education by calling it physician specialists. Now in that competency base, you set up the competency and then you match the instructional strategies with the curriculum, with the training framework, with the monitoring and with the evaluation. And at the level of CPS, we are trying to do that. We had the challenges of variation of training. We had the challenges of postgraduate medical education, and we tried to address those challenges during COVID, before COVID, and after COVID. The challenges, they were related to the induction, we streamlined that. Challenges, they were related to accreditation, we streamlined the accreditation of the supervisor and the institution. Our consultant cannot supervise the training unless he has done 5 or 6 training courses, have certain years of experience, and then ATLS and ACL other workshop. Similarly, the variation of the training that has been addressed, the faculties, they have revamped the curriculum, innovative techniques they have been introduced in the evaluation process like work-based assessment, And then we have now introduced the electronic monitoring system, 100% for all trainer and training. And then now we are going to have the concept of revalidation and recertification. So in this way, we are trying to address the variation of the training. And one thing more, which we have learned during this COVID scenario, is the introduction of the new subspecialty. We are already having the around 70 subspecialty program or the fellowship program. There are now 80.
The monitoring system of the postgraduate training was an eye opener for all the collaborating partners.